Hi, Professor. Today we are going to discuss about the old age home people suffering from UTI in Ontario. So we are the group of two people named Anika and Rajdeep. So now I'm going to give the introduction of my topic. So here the demographic we use 65 and over adult people, and location we are going to focus more on the long-term care homes that are based across Ontario. So moving forward, now we are going to discuss that there is a high prevalence rate. That is why we have selected this study. Around 15 to 50% of residents, they go asymptomatic in the urea, and due to that, they are misdiagnosed and there is inappropriate treatment. And there are around 10% of hospitalization cases that are being seen. And there is a high mortality rate. Around 10% of people, they go with complete complication like sepsis, and they end up been dead. And if we're talking about quality of life and cost, so here we can make some improvements so that the cost can be reduced and the quality of life experience can be increased. Moving forward, I'm going to discuss about the assessment. So here we have to conduct a need assessment. So where we go around and we organize a focus group that can provide us a deeper insight about the current program and management that can be provided, and we answer questions the staff and resident that why we need these programs and what else can be provided for them. And second one is the implementing survey. So in this, the surveys can be handed out to the residents as well as the healthcare providers. So in this, we can see how the incidence on the incidence rate is going on and what treatment protocols are being practiced by the people, and we can analyze the survey so that we can improve our services. Moving forward under the same section, so another thing that we can do is the facilitating focus group. So in facilitating focus group is that we go on a specific program and we only focus on the specific group, such as we can go for the physicians, we can go for the residents, we can go for the families, and we see what are the target intervention that are being used to improving the UTI management. Next is the performance chart review. So in this, we identify the diagnosis and treatment that has been given to the patient, and then we see which can be further used to refine our outcomes and our diagnosis. And moving forward, I'm going to discuss about the strength. So the whole situation, the whole program here, we have the availability of healthcare services and resources. So across the every long-term healthcare facility, there is a dedicated staff and we have resources that helps us to manage these needs. And next is the existing guidelines and reports. So CAN, AGE, and Public Health Ontario, they have their own management guidelines that are being used, and there is a complete protocol how we go and inform these cases. So moving forward are the challenges that are being faced. So it is the inappropriate use of the antibiotics and misdiagnosis. So there is a really high chances of misdiagnosis, as I've already discussed in the introduction, that a lot of cases they go unseen, and due to which the treatment regimen that has been provided is not appropriate. Next comes the lack of consistent UTI management practices. So there is no standardization in the protocols. Next is the better education and training. So more and more education and training can be provided to the healthcare workers. So next, moving forward, we have the capacity building strategies. So number one comes here is the location and training. So we can provide in more location, we can provide more training to the healthcare providers. And next comes the policy development. So it will help us to overcome the problems of not having a proper guideline. Next comes the resources enhancement. So here the diagnostic tools can be more specified to the disease condition, so we know what we are discussing about. So moving forward, we have the services that are already being provided by the Ontario government is the CAN AGE. So here it gives us the advocacy resources. Then we have Public Health Ontario, which offers us the guidelines, data, and reports for UTI management. Lastly, we have the Canadian Institute for Health Information that also supplies with the statistical information. So next will be presented by Anika.
Okay, so first is providing services. In that, there is a healthcare managers, and in that In that, first one is daily briefings, and which is like the regular meetings to review progress and address issues and ensure everyone is informed about current developments. Second is collaborative workshops. In that, monthly meetings to discuss training needs and update to protocols, and this foster treatment and continuous improvement in care practices, which would be helpful for the services. Next slide is about the advocacy groups. In that, so first of all, the collaborative meetings, so regular meetings to align on common goals and strategies. These sessions help ensure that everyone is on the same page or same stage and working towards shared objectives, and which will be helpful for them. Second is joint reports. So in that, co-authoring reports with advocacy groups to promote or enhance the improved practices in UTI management. So this collaboration can strengthen the advocacy efforts and bring more attention to necessary changes. Next slide. It is also about the advocacy consideration. In that first one, first slide is about the priority residents needs and their rights. So first is like about UTI care plans. In that, develop care plans tailored to each residential resident's specific health condition or their disease condition and their preference. So this ensure that care is individualized and respectful of each person's need. Second is about the improving quality of care. So in that, ongoing staff training, which is really important for continuous education and adherence to evidence-based guidelines, are crucial for improving care quality and ensuring staff are up to date on best practices. Third slide is about the ethical consideration. So in first of all, like maintaining confidentiality. In that, like we have to maintain the strict protocols, like implement and adhere to protocols that safeguard resident health information, and this protect privacy and complies with legal and ethical standards. Second is obtaining informed consent. In that, we have to like clear communication between the healthcare professionals, which provide residents and their families with understandable information and about UTI management practices, and they can easily understand the words. So ensure they are fully informed and give their consent before proceeding with the treatment. Next slide is about takeaways. So in that, first of all, we have to focus on collaboration and communication. As I said before, like communication is really crucial to share the information and easy to understand for the patients. So first is value of teamwork. The process underscores like the for the essential work together and communicate clearly, each member's expertise contributing to addressing complex issues such as like UTIs infection or in the seniors. So holistic, second is holistic perspective. In that, comprehensive understanding is emphasize the importance of considering various data sources and their viewpoints. So this approach leads to a more thorough understanding of community health issues and then better for their better solutions. And next is about the practice application. So in that, effective methods, which is really important for the insight gained from community assessment methods, like the stakeholder engagement and data analysis are crucial for improving health outcomes. And applying these methods practically can lead to like the improvement in care of vulnerable population, like in the children or the old age, which are in the vulnerable or even like the pregnancy stage. So these are the takeaways for that. So another is like this is the resource page. So there is a lot of resource. So if you want to find it, then you can. Then another. So thank you for your time and effort to listen us.